So you want to know how to do CPR? Well, then you better keep watching. How's it guys, and welcome back to my channel. Today we will be doing CPR. We will be following the format approach, so we will be asking questions like why, what, how, and if. So the first question, why? Why CPR? CPR is done to try and prolong the time someone can have no pulse without their organs dying. It is to save time so that paramedics can get there, so that they can take over if they need to shock the heart or if they need to give medications to fix whatever imbalance there is. It's to save time to help someone who has no pulse and no breathing. What is CPR? So CPR is when you compress the heart against the sternum and the spine. So you take the heart, which sits in between the sternum being the chest bone, and the spine. So when you push the chest down, it compresses, and what that does is, because the heart is filled with one-way valves, meaning blood can only move in one direction, blood is pumped out of the heart and into the body, creating a small blood pressure, and when you release, the blood moves back into the heart and you can repeat. It doesn't produce a very good blood pressure, and so it doesn't really maintain much in terms of keeping the person alive. So it's not something that you could continue to do forever and it work forever. That is the what of CPR. How to do CPR. So you will have the patient lying on their back. You will kneel as close as you can to their left or to their right. You'll lean over them with your arms straight and your one hand above the other, and you will push hard and you will push fast. For an adult or a child, it's about 5 centimeters, and for an infant, it's 4 centimeters. And you will push at least 100 to 120 compressions in 1 minute. This is how fast that is. If someone's heart stops, they have about 10 minutes. And once they've reached those 10 minutes, there's almost no chance. If you do CPR, that time is tripled to about half an hour, 45 minutes, because you are moving oxygenated blood to the organs. You are able to keep organs from dying, and that's kind of saving time, so that when paramedics get there, they can shock the heart or they can give medications to fix imbalances and all that sort of thing. So it is important to realize that CPR doesn't necessarily fix anything. What it does is save time. It's also important to note that you can do CPR only. Some people will find it challenging to do compressions and give breaths, and then do compressions and then give breaths, where they found that people are more likely to just do compressions if they know they don't have to give breaths. And it has been found in some research that you can in fact just do compressions and it is effective. So it is encouraged to do hands-only CPR when possible. If you come across someone who is on their back and seems to have no life, you can do CPR. However, please watch my previous videos about hazards, hello, help, and airway breathing circulation, so you can better do that and do that safely. That would be the if. How's it, guys? So this is the story time part of the video. We're going to just talk about a quick story where I've either seen or done CPR. The story that comes to mind is that I had a student working with me, and we had come across a lady who had no pulse and no breathing, and so me and my partner started to get everything ready, and the first aider who was with us, I asked, hey, can you start CPR? And he looked at me blank, like I had asked him to start flying a plane. And so I asked him again, can you start compressions? And he looks at me blank. And then my partner asked him to do compressions, and then he finally started compressions. And I think the thing that you can learn from this is that it's not going to be natural. If you're ever going to do CPR and there's no one there to guide you, or no one there to help you, or if it's a loved one or a friend that collapses and they're not breathing without any pulse, it's not going to come natural to push on their chest hard and fast. I, as a professional, the first time I had to do CPR, I was also asked 2 or 3 times to start CPR, and I wasn't sure what he was saying. And so I wouldn't expect it to come natural. I wouldn't expect it to come easy. And it will be hectic, but you may just save a life. So I hope that's helpful. Hope you guys have enjoyed this video. If you found it helpful, please hit the like button. And if you have any comments, please drop them at the bottom too. Please remember that there is a Google Sheet attached to this film. It is there to help you. It's not to test if you're going to pass or fail. It's purely to help you learn. Remember that we learn by doing. So If you watch this video and you think you've learned something, you'd be surprised how much more you've learned if you do the quiz below. So there's a feedback form at the bottom. It's there purely to help me get better at what I'm doing so that I can work out what's working, what's not working, and it would be really helpful if you would do that for me. Thanks again.